Good afternoon, everyone, and thank you for joining us today at our special media briefing. As you know, yesterday the province announced another state of emergency in Ontario, as well as issuing a 28-day stay-at-home order that takes effect on Thursday at 12:01 a.m. This means Hamilton will stay under the stay-at-home order until at least February the 11th, 2021. And during that time, all residents are asked to not leave their home unless it's for essential purposes such as grocery shopping, accessing healthcare, exercising, or going to essential work. It's also critical for as many people to work from home as possible. Simply put, anyone who can work from home should work from home to try and stop the spread of this virus. The order and other new and exciting public health not exciting, but existing public health restrictions are aimed at limiting people's mobility and reducing the number of daily contacts with those outside our immediate household. These are not exciting recommendations. These are daunting ones and challenging ones, but at the same time, important ones for us to continue to follow, even more so now than ever before, given the spread that's occurring in our community. And I know Dr. Richardson will talk more about the key points that we need to continue to reinforce. Things like indoor gatherings with anyone outside of your immediate household are not allowed. Individuals who live alone or single parents are permitted to have close contact with one household to curb the effects of isolation. That means one household exclusively, not one household today and another one tomorrow and another one after that. It is one household, and you stay with that connection with that household for the duration of this order and possibly beyond. I know that's a challenge and difficult, but clearly that is, again, something that's necessary if we're going to curb the spread of this virus. Outdoor gatherings are limited to 5 people, and also including physical distancing and masking. Masks are continued to be encouraged, and if you cannot maintain the masking and physical distancing outdoors, then don't go. Don't be part of that exercise. You want to be able to maintain that physical separation at all times and keep that mask on at all times, and we can possibly reduce the spread of this virus. So I can't stress how serious this matter is. I know the Premier certainly outlined that yesterday. The spread of this virus is accelerating, and our ability to contain it lies in your hands, quite frankly, individually. We can't be in every household, we can't be in every business, we can't be in every store location, and we're going to try to make sure that we enforce these regulations and rules. It really is an individual choice to take part in and participate in and adhere to these stay-at-home measures. And as the Premier said, stay home, stay safe, save lives. And I think essentially that's what we're talking about. So do your part, trust the experts. The scientific recommendations that are coming forward are there for good reason. It's for your protection and the protection of others and your family members and the community at large. Continue to follow those recommendations, and hopefully we can get on top of this virus sooner rather than later. I know that the doctor and Paul Johnson will talk about the vaccine, but to talk a little bit about how this is going to play out in our community right now, our EOC manager, Paul Johnson, is with us and will lay out some of the details in terms of how these control measures are going to be put into effect. Paul?
Well, thank you very much, Mr. Mayor, and echo your comments that we're heading into a very important time in terms of stopping the spread of this virus. And really, we've entered into a 2-track approach in our communities. You've heard in previous media conferences and in other meetings throughout the community, we are starting that rollout of the vaccine, and Dr. Richardson and her team are doing a great job on that. But at the same time, we are dealing with a very serious situation in terms of the number of outbreaks that are occurring in our community, the number of people who are with COVID-19, and we need to do our part, and these measures are meant to do so. In terms of its impact on the City of Hamilton, I am announcing today, after discussions at the Emergency Operations Center and talking with our council this morning at their General Issues Committee meeting, that all of our counters and our public areas to do business with the City Hall, our municipal service centers, our licensing counters, all will be closed to the public starting tomorrow. That is so that we can comply very clearly with those who are able to do their job from home, because the services that are provided, almost every single one of them is available through an online or over the phone perspective as well. And so the ability to book appointments and come into our City Hall, municipal service centers, or other counters is going to be suspended, and all of those facilities will be closed to the public starting tomorrow. Those who had booked appointments will be contacted throughout the day today in order to alert them as such, and we will need to move back to where we have been in the past, with people engaging through the phone, through email, through the website, and all of those electronic channels and virtual channels that we have in order to get the work of this community done, and in order for your government to, local government, to support you in the way that we need to. We are working with all of our staff right now throughout the organization to ensure that as an employer, the City of Hamilton is complying with the work from home direction that the province laid out yesterday. And we will be ensuring that only those who need to be at work will be at work. Of course, at the City of Hamilton, we have many workers who are essential in their job and essential to be in a workplace, whether that workplace is throughout the community, like our first responders, waste collection, some of those elements, or whether it's essential work that has to be done in an office environment, like our customer contact center, who are answering your calls and are able to handle calls from the public. So we'll be analyzing that today and making sure that we're complying with that piece, which is really important for all businesses to look at. It is now an expectation that businesses and organizations are ensuring that anybody that can work from home is working from home. There was mention, of course, about impact on construction over the last couple of days as these rules are moving through. We still don't have all of those rules and regulations in writing. I can say that by and large, construction that is underway, or construction that is essential in nature, is going to continue. And so there's not going to be a mass shutdown of construction in our community, or any community across Ontario. But there are some nuances to it that our staff will be working through, and through our building services division will be ensuring that those who are in the construction industry have good access to information and are very clear in terms of what those requirements are. In terms of enforcement, which has been a big topic of conversation, we have not yet received the written confirmation about what enforcement of particularly the stay-at-home order, what that means and what it looks like and what the parameters of that are. You've all heard the Premier speak to this being about each of us making our good individual choices and complying with the general parameters of this. Is that each time we leave our home, we ask ourselves, do we really need to do this? What is it for? What is its purpose? And is it really necessary? And some of the obvious really necessary pieces are, of course, about getting food and other important supplies that we need in our home to survive. It could be about going to a medical appointment or the pharmacy and those types of things. Or, of course, if you have to go to work because you do have to, in your job, be in a workplace. Those are pretty easy for all of us to understand. Where it's going to come down to a little more of your personal decision-making is on other things. Clearly, there is the ability for us to get out and exercise. And that does mean that the City of Hamilton will continue to operate our outdoor recreation facilities that are allowed to be open, and they include our ice rinks. It does mean tobogganing hills are still open. It does mean trails and playgrounds and parks are still available for people to access. So that's the good news. And yes, part of being outside in an essential capacity is to get some level of exercise. But it's meant for that. It's meant for our mental health and our physical health to get outside. It's not meant to be a lengthy social opportunity or a chance to go to multiple locations and do multiple things. It's a chance for us to get out regularly and enjoy an opportunity to stretch our legs, be active, walk, run, roll, however you need to get out and exercise to do that. And of course, for those who like to get on the ice, to skate around. When we are outdoors, we're being asked to wear a mask at all times when we cannot maintain that 2 meters of physical distancing, which is something that we've talked about for a long time. But more and more, we're just encouraging people to wear a mask unless it's really obvious that you're not going to come in contact with somebody. Then you may want to remove it. But in general sense, if you're out, particularly in places where other people are around, why not wear the mask? It actually helps keep your nose and mouth and chin a little warmer in these cold months as well. So our website will be updated with the regulations as they become known, particularly around stay at home. A lot of people are asking, do I need a letter to take with me that says I have to work somewhere and those types of things? Please don't jump to those conclusions. One thing that I can say, because I've listened to the Premier over the last couple of days, this is not a curfew. There are not defined hours, and this is a very different approach that the province has taken. We will have the ability to enforce certain things, and we will take that opportunity to do so, but it'll be very much in keeping with what we've been doing in the past. We will be attending both private residences, public places, and businesses if we feel that numbers are beyond the limits that are set by the province and by these regulations, or if there are other violations in terms of physical distancing or not wearing a mask. The time for education on those types of things is over. So if social gatherings are occurring or businesses are not following the rules, those who are allowing people inside because they can under the regulations, if all of the rules are not being followed, you can bet that there will be tickets issued and charges laid appropriately by our folks and also the other provincial members who can come in and also enforce, whether that be from Ministry of Labor and other areas, and of course our local police officers as well. So enforcement is going to occur in many of the ways that it has already. Hamilton has been in lockdown now for a little bit of time, so we know what some of those rules are, and we'll continue to do that. And we'll continue to make public any other changes in enforcement that may come as we get more information about the stay-at-home order. But I just want to reiterate that we have not yet received in writing what the enforcement around that order looks like, what the fines are. We expect them to be similar to the fines that are currently in place, but we do not have written confirmation of that on the stay-at-home side of things. But on all the other elements of this, those rules are clearly laid out. The fines are clearly laid out. Our bylaw officers, our police officers, and our provincial partners are enforcing on a 7-day-a-week, morning, noon, and evening basis complaints as well as proactively driven. And in particularly those businesses that are open. And there are some big box organizations that are open. We have obviously grocery stores and pharmacies and things. Those will be of particular attention because they are still allowed to have people inside in an indoor capacity. And we want to ensure that every single rule that is in place, both locally and provincially, is being followed. With that, I'll turn things over to Dr. Richardson.
Thanks very much, Paul. Just going to go over some case numbers, talk about the vaccine a little bit, and then talk a little bit more about shutdown, as Paul has said. So we're at 7,720 cases today in Hamilton. That's 158 new cases since yesterday, and we're sitting at about the 158 cases per 100,000 population per week level. So still at that high case level. About 79.6% of cases are recovered, making it 1,111 cases today for Hamilton. There have been 206 deaths in total to date, and we've reported no new deaths today. And we currently have a total of 34 local outbreaks on our website with no new outbreaks added today. As always, you can find the details around the COVID-19 cases on our website, and I encourage you to look there. Before we do get to talking about the emergency order, I do want to talk about the COVID-19 vaccines and give you a bit of an update there. As of this morning, we have vaccinated about 7,500 people through the fixed site clinic at HHS, at Hamilton Health Sciences, and approximately 800 at our mobile site clinic, which is going to long-term care homes and high-risk retirement homes. The team will be going through and attending all of these with a target date of completion by January 18th. That's going to be contingent on our supply of vaccine and as well just the logistics of going into the homes and them being ready to receive us. They'll see over the course of this time about 4,900 residents that are located in 37 homes. And so that's the target group as well. Although the long-term care home workers and retirement home workers have been getting vaccinated through the HHS site, we'll be offering, we do offer when we're there for people to get caught up on that side as well. Today, the team is at Wentworth Heights, and tomorrow it's expected to be at Arbor Creek and at Grace Villa. So we are closer to knowing when we're going to get the shipment of the Moderna vaccine here in Hamilton from the province. And if things work out, we are anticipating that we'll be able to use this product before the end of next week. There are working groups that draw together people from across the Hamilton Health sector. So that's people from long-term care, from hospitals, from primary care, as well as ethicists and others who are consulting with groups across our community about the sequencing of the COVID-19 product. And that sequencing order, of course, is being largely driven by the provincial framework that they have issued and then specific provincial direction that they are providing. But it is that group that is doing the work to gather together the people in each of the priority groups that are there to work with us to promote the vaccine, to have people understand what the vaccine is, and to be ready to receive it. The stay-at-home order that was announced by the Premier yesterday is a very necessary step as we're going forward. As you know, we've been sitting around the 150 to 160 cases per week, per 100,000 per week, I should say, here in Hamilton. And we've had numerous outbreaks, increasing numbers of outbreaks, particularly in our congregate care settings that serve vulnerable people. So this is really important in terms of stabilizing those numbers of cases and reducing the number of deaths, particularly in those vulnerable people, and destabilizing our healthcare system and the congregate care settings themselves. That's a very necessary step in order to save lives. So just I'll reiterate it again because I do think we need to keep saying these things, but outdoor organized public gatherings and social gatherings have been further restricted to a limit of 5 people. And really that's to make sure that people are able to get out with their people that are in their households. And as Paul said, this is for exercise. This is not a way to get together to socialize with others. This is there for your mental health and your physical health. Virtual gatherings or events are, of course, the safest way to continue to keep in touch with people because connecting with people is an important part of what we need to do even during this time. And it's so important to our mental health. It's so important to sustain those relationships. Indoor gatherings are reserved only for members of the same household. And you should be staying at home as much as possible, except for those absolutely essential trips that you must do. The piece about working from home is something that's very important. We've seen this in our outbreaks that happen in workplaces, and certainly every employer is being asked to make sure that if the people can work from home, that they do work from home. And you know that we're putting that in place for the City of Hamilton ourselves. A face mask is very important, whether you're indoors in a workplace, if you have to go to work, if you're an essential worker who must go to work, but also in public places outdoors. If you're going to be around other people, as Paul said, it's a good idea to wear that face mask, and it is an extra benefit here in these cold times to have that on. As well, for all of these rules in terms of what we're talking about, these recommendations, this guidance that's been given to you, we really need to find a way to comply with these things rather than to find ways to get around these things or exceptions that might be there. They're so very important that in terms of keeping people healthy and saving lives. The province also announced that it's going to provide up to 300,000 COVID-19 tests per week to support key sectors such as manufacturing, warehousing, supply chain, and food processing, as well as continuing to do tests in schools once they are reopened, as well as long-term care homes. So I know as we've been talking about these things and about the prospect of another even more closed down lockdown that we're going to go through with the stay-at-home order, that this may bring up a lot of emotions for people. They may be disappointed in terms of where they are, they may be angry about it, all of those sorts of things, sad, feeling a bit hopeless about this, and especially after 11 months of many, many people trying to work hard to stop the spread. And we're going to have to continue to do that. But I would absolutely encourage each and every one of you to take the advice that you've heard today, getting out for walks in your neighborhood, getting some fresh air, getting some exercise, taking up a new hobby, connecting with people outside of your home. These are all so important for our mental health and for our own resilience. And really, we need to rely on that as we go forward. Check in on your own mental health on a daily basis and reach out to others if it's needed. And remember too that those around you need support. So call a friend, call a family member. If you need services for yourself that around mental health issues or around addictions issues, there are people there and you can find out there to help you. And you can find that information on our website at www.hamilton.ca/COVID mental health. So please hang in a little while longer. It's a very important time as we're moving forward. We're at the tipping point around this virus within our community in terms of making sure we can sustain our systems, sustain our healthcare systems, and with hope with the vaccination programs as we're going forward, that we'll continue to see those be impactful in terms of reducing the rates of serious disease as well as outbreaks and of course death. So let's stay at home, let's get through this together. And I know it's something we can do here in Hamilton. Thank you.
Thank you very much, Doctor and Paul. And just to reinforce the message again, that this is really all about taking some personal responsibility to ensure that we are doing the right thing to help stop the spread of this virus. We can all kind of rationalize ways around this. Why is it that I can go tobogganing and skating when I have to stay at home? Well, clearly it's about being at least an opportunity to get outside and get some air, but not an opportunity to go and socialize and connect with people. Stay physically distance yourself, keep the mask on. The reason why this is all happening is to avoid the spread of this virus. So rationalizing all the variables really doesn't matter. The bottom line is when you can and frequently as much as you can, stay within your own household. Don't invite other people in. Only if you're single can you dedicate a family that you can socialize with. Beyond that, stay within your own household. Get out for some exercise. Touch base with your family members through Zoom and Facebook and all the platforms that are out there that help us stay connected. It is collectively all of us need to be doing this, not just some of us. And so I do want to thank all those that are. And the vast majority, I believe, in our community are doing the right thing, are doing everything they can to make the sacrifice to stay apart. I know that in our family, sons and daughters we're communicating every day, and some have lost jobs or are struggling to keep their jobs and keep functioning in our community with little kids. And families, children, grandparents, all of us are struggling with the anxiety around this, but we have to turn that anxiety into action so that we can reduce the spread of this virus and get the vaccinations done as quickly as supply will allow. And I think that's the speed at which we're going to go. The supply will dictate how fast we can get this into the arms of individuals based on a priority scale. And the sooner the supply gets here, the sooner we can get these vaccines into arms, and the sooner we can get to some sense of normalcy somewhere down the road here in 2021. So thank you for everything you're doing. Let's keep doing it. We know it's hard. We know it's difficult. We know it's frustrating. We know it's challenging. We're all feeling it, and we are still all in it together. And we're going to get out of it together as well if we all take our collective responsibility to do that. I'm going to turn it over to Jasmine for any additional media questions, and then we'll come back to you to close it out a little later on. Thank you.
Great, thank you, Mr. Mayor. We have 5 media in the meeting today. We'll start with one question and one follow-up for everybody. First question will be to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. The first one is for Paul Johnson. So if outdoor recreation becomes problematic, like physical distancing isn't being followed and people aren't wearing masks and physical distancing is impossible, will Hamilton move to increase enforcement at skating rinks, playgrounds, the escarpment stairs, maybe even tobogganing hills, or even consider shutting them down? I don't know if you guys have the power to shut down tobogganing hills, but...
So we will take action if we need to, and you're quite right. We would, be able to take action in certain cases. So the city of Hamilton does have some designated tobogganing hills, and we would obviously be able to take action in those cases. And we do have our own designated ice rinks. The outdoor ice rinks, I'm a little less concerned about. They are staffed when they are open. There's a reservation system, and we do tightly control the numbers. Use of those ice rinks outside of hours is not prohibited. You will be ticketed and fined, and we do actually have security on site at the closure. But I had a story the other day. So we put security on for when our staff finally leave about 11 o'clock at night. The last skaters come off about 10:30, and 11 o'clock at night, our staff are leaving the area, and we have some security on from 11 o'clock through to the early morning hours. And we thought that was to discourage people from that late night piece. Now we hear people are coming out at 4:30 in the morning and getting on the ice and using it. The bottom line is you can't. Don't. You're not allowed to, and you will be fined. So we need to crack down on that. We will continue to crack down on it, and we'll see how things go. I would really hate to start to close things like those ice rinks, which I think can operate in a safe way if we all do things right. But where the city can take action, we will, and we will be enforcing, remember, physical distancing bylaw, the masking bylaw and things, that's everywhere. And so we will be attending any large gatherings, any areas where we feel there are just too many people not following the public health measures and take those particular actions. But in terms of closing down all elements of people getting outside, that's pretty impossible. But we would be able to do that if the ice rinks just aren't working, or if our sanctioned tobogganing hills just become too problematic. That is a step we could take. We hope people respect these rules and respect the opportunities that they have and continue to use them accordingly.
Thank you. And my follow-up question is for Dr. Richardson. So Dr. Richardson, how are essential caregivers being prioritized for vaccines? Are they being selected by the home where their family member is? And how many have been vaccinated so far?
Thanks very much for that. In terms of essential caregivers, there is a process that the province set up with the homes to register people as essential caregivers, and the homes then work with those lists, provide them to us through, and then they go through and get invited to come to an appointment.
Great, thanks, Dr. Richardson. Next question to Matthew from the Hamilton Spectator. Matthew, you can go ahead.
Hi, folks. Thanks for helping us out today. I think my question would either be to Paul Johnson or Dr. Richardson, but I had been speaking to the head of the transit union locally, and he had mentioned that even a couple of weeks ago, before we had thought that there would be a stay-at-home order, their union had asked the city to consider whether they could start reducing the number of passengers on buses again, like we did in the first lockdown. And he said he was told that that's not necessary yet. But I've heard from some riders as well who have wondered why we haven't done that. Could you explain why we're still keeping 100% seated capacity at a time like this?
So we believe that the measures that are in place, including mandatory masking on transit, make that a safe mode of operation. The reality is the numbers are greatly reduced. If you look at what our normal capacity would be and our normal usage of our transit system, it dropped considerably through here. And once we've gone into lockdown, it's dropped again. And I expect now it's going to drop even further as more people are staying at home. So it's always something we monitor. The transit operations folks are great at figuring out where they need to put more buses on. We do have the ability for drivers to do pass-bys, and if the bus is at a capacity where they don't feel it's appropriate for even more to be put on, thankfully that doesn't happen a whole lot, but it's there. So I think all of those pieces are in place right now, and as always we continue to monitor it. But the usage of our transit system is so greatly reduced at the moment. We're not looking at putting in more strict requirements at this time, and we'll continue to see how things work. But we should see another drop, quite frankly, in usage of this, because again, transit is there also as a transportation mode for essential only. It's not a place to go joyriding or just kind of hanging out and staying on it. It's to be used for those essential pieces, getting to work. It shuttles essential service workers to really critical jobs in this community. It's there for people to get out and get groceries. It's there for people to get out and do those essential pieces. And hopefully we can maintain it at the level it is right now. But Matthew, no plans at the moment to throttle back numbers on the buses, but we continue to monitor it as we have throughout this past 10 months.
Okay, and I guess in a follow-up to that, both the driver I spoke to and a couple of passengers had both raised with me the kind of the scary prospect of a variant of this virus that might be spread more easily, that they've been talking about increasingly in some areas. And that, as I understand it, was the union's reason in particular for asking whether we would consider dialing back the number of passengers in a mandatory way. Would that, if we start seeing proof of that virus variant in the community, would that change the way we look at our transit system working?
So again, throughout this pandemic, we've worked very closely with Dr. Richardson and her team. Every step that we've taken in terms of how we've been operating our transit has always brought in the best advice from our public health unit. So, Dr. Richardson can chime in with additional pieces, but I can tell you from an EOC perspective, at all times along the way, this has not been a transit-only decision, an EOC-only decision, without making sure that we have, talked about the realities of this with our public health unit.
Thank you.
Great. Next question to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much, Jasmine, and hello, everyone. My first question is for you, Paul Johnson. I'm just wondering, I know you've received limited details so far from the province, but what are you anticipating the role will be for bylaw officers to enforce the stay-at-home laws? How many officers do you have, and are they prepared to do this?
So from a preparation perspective, absolutely. I have, huge praise and admiration for our bylaw folks. They have been throwing a whole series of things throughout this pandemic that they need to do, some that we've agreed to locally and others that have come from the province, and they're just doing a fantastic job. We'll need to get back to you with the exact numbers. I don't have off the top of my head how many officers we have. But what I can say is this, listening very closely to the Premier today, I tuned into the press conference at 1 o'clock where there were a number of questions about this. I think that it's very much going to follow what we've been seeing throughout this pandemic, where the role of bylaw is to proactively, in some cases, seek out that behavior which is clearly outside of what are these broad public health and business related guidelines and safe working guidelines that we need to have, and that they are there to make sure that those are stopped and that appropriate action is taken. We don't have enough people to be everywhere in this community. We have over 1,100 square kilometers of surface to cover. We have, any number of private residences as well as the public spaces and businesses and organizational space. So we can't be everywhere all the time, and there are no new resources coming. This is a shared responsibility among those who enforce those types of rules. And so police and our bylaw officers and the province will work together on this. And our goal will be to seek out those that are clearly violating the spirit and intent of whatever, or the actual regulations themselves. And, so to those, it's pretty clear if you have large social gatherings or any social gatherings indoors, that's a violation. And people know that by now. If businesses are clearly not following the rules in terms of how they should be operating, then that's a violation, and we'll take care of that. And I think the stay at home is going to be the same piece. The Premier was clear, and I can't imagine how we'd ever operationalize it, that it's not going to be people at the end of every street. It's not going to be a constant asking of exactly what people are doing. It's impractical. It couldn't be operationalized, and that's not the intent. The intent here is that people limit the activity that they're taking on and the types of activities they're taking on. And once we get clarity, we'll be able to provide the community with some guidance around what that enforcement looks like, and in particular, what those fines might look like. But I would say that, the community can look to what we've been doing to date with all of the bylaws and the charges that we're able to levy under provincial orders or local bylaws, and we will be taking that same approach. I'll end by saying, and I said this in my remarks as well, the one difference here is that we are not looking at a long period of education. We will start to enforce to the regulations once we receive them. But this is not going to be a case where for several weeks we're encouraging people and educating people. People need to follow the rules, and we are in a fine and compliance role now, not in an education role, which we were much earlier in this pandemic, trying to get people to understand the rules. Right now it's about complying with those rules.
Thank you, Paul. And my follow-up is to the mayor now. This is kind of the same line of questioning, but in terms of the role of Hamilton Police, do we know what role Hamilton Police will have in this, and will more officers be put on the front line?
No, and I think, thank you, Nicole, for that question. And I think we're not going to be adding additional officers at this point, but I think the officers are going to be charged with maybe leaving behind some of the other normal enforcement things that they might do to change gears and do the work here in terms of enforcing this very important recommendation to stay home. So Added resources is a budgetary item, and I think that that is something that we dealt with a couple of years ago. We added an additional 25 police officers. Certainly, there are some in our community that we ought to be reducing. When in fact, I think many in our community suggest that they want more policing. At this point in time, I think policing is going to be very much involved, and I think we'll ask our police force to kind of realign their resources to ensure that we do a proper job of enforcing these new provincial recommendations for people to stay home. Again, it's not all the police force is not going to be working on this, but there's still other policing matters that need to be dealt with on an ongoing basis. We're not going to free up our community to let infractions and crime happen while we're distracted by this, but certainly this is going to attract additional resources that hopefully will do an effective job of impressing upon people that this is a serious matter. Police can be laying charges, as well as bylaw officers, as well as provincial workplace enforcement officers. All of them are going to be employed to ensure that we can do the best job possible of getting people to adhere to these recommendations.
Great, thank you, Mr. Mayor. Next question to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone is having a great day. My question, I'm not sure who this is for, but we just mentioned that this comes down to personal responsibility, but these rules are confusing. Doug Ford is saying they aren't, but they are. I mean, city councilors have questions, our readers have questions, and I just wonder, how much of a role do these rules that don't necessarily make sense and an inability to effectively communicate them play into this pandemic continuing on like this?
I wouldn't mind kind of narrowing the focus down to, all the rules in the world here relative to different sectors really narrows down to a sense of personal responsibility and having people think about what's essential and what is not essential. And, when I think about essential work, I think most companies and organizations have already come to a conclusion that, if they're working in an office, they can find ways of having their workers not work in their office, but work from home. That's happened in very significant ways. The next step is, what essential work or what essential outing do you need to have in the community? It breaks down to, well, look, if you have to go to work and you're required there and you're doing all the physical distancing and required as part of the workers' requirements, then you need to go to work. If you need to get groceries, you need to get groceries. And what we've said is, if you need to get groceries, don't take the whole family to go and get groceries. Have one individual go, get the things that you need, and then come back home and continue to stay within your own household. Is there a need for you to go visit your son, daughter, or anyone else and have a social gathering for the next number of months, or at least during this period? Has that been the case over the last 3 or 4 or 5 months? No. The answer has been, just take personal responsibility and stay within your own household as much as you can. All the other rules around, can you go out to, spend some time outdoors? Of course you can, as long as you maintain physical distancing and masking, that the opportunity is there. Should you go out and socialize with your entire family outdoors at this point? No, this is not an opportunity to have that kind of a gathering. So I want to break it down to kind of simple rules. And the simple rule is stay within your own household as much as you can, other than for essentials. And I think those essentials are work, getting groceries. Beyond that, I'm not sure, medical appointments, and beyond that, stay within your own household. Doctor or Paul, if you want to add anything more to that, feel free.
Seeing shaking heads, Bobby, you can go ahead with your second question.
Thank you very much, and I appreciate that answer. My other question is, as Matthew is saying, this kind of fear of COVID variants, and I understand that the COVID-19, SARS-CoV-2, whatever you want to call it, I realize that it mutates and it changes, often, but I just wonder if there's any indication that we're seeing different variants in Hamilton. If so, how many? Is there anything you can provide there, Dr. Richardson?
Yeah, sure, Bobby. We can give you a bit of an update on that. We do hear from our provincial colleagues. They are doing what we call surveillance for these variants. They're going through and checking samples that come in, that any that have, any somebody's had a contact with somebody who's traveled, or if there's an example where there seems to be a lot of spread occurring, they're going and checking those samples. And it's really important that anybody who's taking tests flag if they see any of those characteristics, because the lab will pick those out and test them straight away to see whether or not they have the variant. So they're doing that work, trying to see if there's any here. We do know that there have been some cases in Ontario. As of yet, I think we're at about 14 cases, but best to check the provincial website for the latest numbers. And we haven't yet seen any of that here in Hamilton, but we're very much aware of it. As I said, we're asking all of the people who are taking any tests, if they see anything that describes those characteristics, to put those on the requisition so that we can make sure to identify them as quickly as possible. And of course, all of our staff who are doing case and contact management and outbreak management, they have that in the backs of their mind as they're watching and seeing what happens as well.
Great, thank you, Dr. Richardson. Next question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My questions are for Paul. I'm wondering when you expect to get more information about how enforcement is going to work. And I know you're saying like there's not going to be a period of education, but we're 10 hours away from this coming into effect, and no one really understands how enforcement's going to be working. Is there going to be a bit of a grace period? That's my question.
Yes, and to be clear, when there are new rules put in place, there will be a tiny piece of us getting the communication out and a piece of time where we do that. What I don't want people to think is that that means every rule. As many of the things that we're enforcing, it's only really the stay at home that we're a little less clear about what that means. Everything else, we're pretty clear. We know what that means. So there is no, when it comes to physical distancing, when it comes to mask wearing indoors, when it comes to businesses having safety plans available on request, none of that stuff has any grace period. To your point, we are still waiting. We had hoped that we would receive it overnight. It doesn't look like we're going to get it until through the day. And there is some discussion that it may not even come until this evening. And so obviously that creates a challenge in terms of how we communicate that on the stay-at-home piece only. But as you can tell, my nervousness is saying that there's a grace period. People say, well, that must be on everything, or that we're going to educate on everything. Absolutely not. But we will always recognize that if we don't have information until this evening, it will be really hard for the person that's getting up first thing tomorrow morning to understand what stay-at-home enforcement looks like. But in terms of what the mayor said, I agree wholeheartedly. We do know what stay-at-home means in the broad sense of it. If you're really going to have to get into the parsing of the enforcement of it, then it suggests people may be looking at ways around it. But I do understand that people need a bit of time. We will get that information out as soon as we can. I wish I had it in hand. We were expecting that we might have it to share at this time, but we do not. So it's not a case of us not being able to share it or not wanting to share it. It's we don't have it yet.
Thanks for that. And so this is a stay-at-home order, but people in our city live with homelessness. I'm wondering, can you give us assurances that people who are homeless are not going to be ticketed simply for not being at home?
So there's no indication that this is going to extend to persons who are homeless. If that changes, of course, we would have some challenges in my mind with how we would ever enforce that anyway. So our work continues. Obviously, we believe essential work is the outreach that occurs every day in this community to help people navigate from homelessness to appropriate shelter and housing. So they will not be taking a pause and trying to work from home, because that would be impossible. So our work continues as it has been, and we do not anticipate, nor has there been any indication from the province that this would extend to persons who are homeless.
Thanks, Paul. We have a bit of time left, so we'll go through again for one more question each, if you would like. We'll start with Fallon from the Hamilton Spectator. If you'd like another question, Fallon.
Hi. I guess like another question is, people have been told this whole time to sort of support local, support cafes, restaurants, but will that be like, I know we don't know much about enforcement, but will people be ticketed for, going to get a coffee or going to pick up takeout? Like, I guess we don't know the rules, but is that something that could happen? Because that's not necessarily essential, but something that we've been told to do this whole time to keep the economy afloat?
So we don't know, but again, it's not our anticipation that that would be there, because very clearly the rules that the province provided did produce some further parameters on retail, certain retail in terms of hours of operation for certain retail, but curbside takeout, curbside abilities to access businesses as well as restaurants and things. The drive-throughs, there's no indication that they're closing. In fact, there isn't. The wording is they're able to operate. So again, where things are available, I think the importance of the stay-at-home order is that we take that into account as those things we do with a more infrequent basis. And if there are ways that we can do things from our home and still support local business through deliveries and other things, that might be a way to go. But obviously the retail wasn't shut down entirely. Other things weren't shut down entirely. So we have the ability to do that. And it would be hard pressed to say that those are open and available for folks and then turn around and say, but if you show up at it, there's going to be a ticket. So I can't imagine that that's going to be what people will hear when we get the information.
Thanks, Paul. We'll go next to Bobby from CBC Hamilton. Bobby, if you would like another question.
Yes, thank you. I guess my other question is if maybe this is for the mayor. I understand that Diamond and Diamond lawyers have filed a class action lawsuit, and they've named Hamilton and some of the long-term care homes that the city runs and other ones in Hamilton. Do you have any response to the class action?
No, my understanding is that this firm has launched a number of class action suits throughout Ontario over the last several months. I don't have any details around what their claims are in terms of their suits. So we'll certainly leave it to get a briefing from our legal department. I think this was just released this morning, as I understand it. So I'm not aware of the details, but we'll certainly dig into it and get some advice from our legal counsel as to what our response needs to be, and clearly we will defend.
Thank you, Mr. Mayor. Next question, back to Katrina Clark. Katrina, you can go ahead.
Thanks very much. I'm wondering if Dr. Richardson might be able to comment on the hospital outbreaks. I think there are 8 active ones right now, but just speaking to, if this is concerning, if they seem to be under control, that sort of thing.
Yeah, thanks, Katrina. The number of outbreaks that we've had anywhere, we're at 35 today, 39 yesterday, active outbreaks. It's very concerning just in general, whether it's in the hospitals, whether it's in our long-term care homes or retirement homes, other congregate settings. These outbreaks really are a reflection of the degree of transmission that's going on in our community, and we need to see those rates come down. And until it does, we're going to be at risk of having more of these outbreaks as we go forward. So they're working very hard on bringing those under control. It's very challenging across the health system because the health system is strapped and in terms of health human resources, and as well because of the number of cases that are out there and needing to have care. And so it is worrisome from that perspective. That said, our hospitals have very good infection prevention and control resources. They're working very hard to bring these under control, and we're working with them to support them as we can, but they're very much experts in doing that work.
Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions today. We'll pass things back to you.
Great. Thank you very much, media and others, for tuning in today and asking your questions. We appreciate it. And Bill Custers, the entire team at Cable 14, as well as Clear Cable, for helping us make these media availabilities run as smoothly as they do. Much appreciated. And again, the message in Hamilton is clear. Please stay home unless you require essential products or work. So I think we want to narrow it down to a simple message. The more that you can stay home and avoid contact with other people, Stay within your own household. The better off we're going to be over the short run. And as we continue to vaccinate folks in our community as quickly as supply will allow, we'll get into a much better space in the coming months if we're all able to do that. If you have symptoms of COVID-19, get tested, self-isolate until you receive the results to keep our community and your family members safe. Book an appointment at hamiltoncovidtest.ca. Where you can book a test and get that test hopefully done speedily. And I know that the results are coming back a lot quicker than they have in the past. So the better off for you to get tested and know what your results will be so you're not stalemated for too long. More information on COVID-19 is on our city's website. You can find that at hamilton.ca/coronavirus, not only on our response, but also in terms of resources that are out there for you to get through this effort, including mental health supports for those that are challenged by this. And we know that this is aggravating and increasing anxiety and mental health issues in our community. It needs to be attended to, and there is help out there, so please avail yourself of that. And yes, there is a light at the end of the tunnel relative to the vaccines that started, but it is going to take us some time to get through that process. So bear with us, stay with it. We need to fight through this collectively, and hopefully we can get all of you to participate so that we can come to a better day in the near future. Lastly, our regular scheduled media briefing will be for January the 18th at 3 p.m. So we look forward to talking to you then, hopefully with some better news around cases or vaccines or the spread of the virus, hopefully some reductions that we can highlight at that point. So stay tuned and stay focused and stay safe. Thank you.